Hello everyone, this is Dr. Aparna. I'm a Senior Consultant and Fertility Specialist in Oasis Fertility, Annanagar, Chennai. So is PGS treatment necessary and how does it help in the success rate of IVF? Now what is PGS? PGS is pre-implantation genetic screening. Now it can be done either for aneuploidy, that is if the chromosomes are not all right, or it can be done for monogenic disorders, that is if there is an inherited disorder in the parents so that it does not come in the offspring. So these are the two reasons why we can do a PGS, and generally PGS, so we call the one for aneuploidy as PGTA, pre-implantation genetic testing for aneuploidy. It is done in parents who are elderly and who have a high DNA fragmentation index, or if they have had history of recurrent pregnancy loss or recurrent implantation failure. So in these cases we do something called a PGTA. So how does it help? It helps because if these embryos which were not tested for PGT, if they had been transferred, then it could have ended in a miscarriage. And so PGTA helps in the sense that the result which we get, either it can be a euploid embryo or it can be an aneuploid embryo. A euploid is a normal embryo which we can transfer, and aneuploid is an abnormal embryo which we cannot transfer. In between we have high mosaics and low mosaics. Of course the recommendation is given whether we can transfer these embryos or not, and we counsel the couple accordingly. So PGTA helps. PGTA, that is pre-implantation genetic testing for aneuploidy, helps in transferring euploid embryos in couples in whom there has been a history of recurrent pregnancy loss or recurrent implantation failure, or if they are elderly couple, or if the husband has high DNA fragmentation index, or there has been repeated abortions in them. So it helps in achieving a euploid pregnancy in couples. So definitely PGS testing increases the success rate of IVF because we know that the embryo we are transferring is a euploid embryo is a normal embryo. Now normally IVF success rate, it's between the it's a dialogue between the embryo and the endometrium. Endometrium is the lining of the uterus, so that is the seed and the soil. So both should be perfect for a proper implantation and a continuation of pregnancy to occur. If there is a problem in either, then there would not be a successful pregnancy. So this eliminates half the problem. So if we have done PGT testing for an embryo, we have done a genetic testing for an embryo, and we have got a euploid embryo, it means what we are transferring is a normal embryo, and therefore the results of a successful pregnancy with a normal embryo is much greater than with an embryo in whom we have not done a chromosomal analysis. And if there has been any inherited condition in the family, like for example epidermolysis bullosa or any other genetic condition which can be inherited in the offspring, and sometimes it may be or may not even be compatible with life. In these cases we do a test called PGTM, which is pre-implantation genetic testing for monogenic disorders, and in this also we can find out whether the embryo is affected with the disorder or not. If any embryo is affected with the disorder, we can discard the embryos and we can transfer the embryos which are normal. So therefore PGT helps the couples in achieving high success rates because it gives a euploid embryo. 1, 2, in PGTM cases it can eliminate the risk of the disease in the offspring.